Well, from the revenue cycle management side, we are going to actually ask Beste Kuru to join us today. So we do actually give a lot of updates from United Medical side, but also like all the related news from for the COVID and other stuff. So we sometimes neglect our own core business, and that's our revenue cycle management. Last week, Richa Savason was with us, and she gave some updates. And then I asked Beste to join us and introduce herself first, and then tell us about why UM is doing better than other companies in the same field. So Beste, if you can please introduce yourself.
Sure. Thanks for having me, Kamal. Hi, everyone. My name is Beste Kuru. I am part of the revenue cycle management leadership at United Medical. As a senior client manager, I work with managers setting RCM goals, monitoring trends, and helping coordinate team efforts towards successful clients' account management. I have been with United Medical for over 5 years now. I am ACMP board certified, and I have an MBA as well as Masters in Finance, Healthcare Management, and IT.
You have several of them, right?
I do. Kamal, today I wanted to talk about the strengths of our RCM team, as well as how we ensure increased revenues for our providers. So I am really proud of being part of this team at United Medical. We have extremely talented individuals on our team, and most of them actually hold master's degrees from top colleges and universities. One thing we extremely highlight and enforce at United Medical is continued education and ensuring proficiency in healthcare management. So right now, all of our managers either hold or they are working towards their ACMPE board certification via MGMA. And we also make sure all of our staff members have access to MGMA resources, and we have a strong partnership with MGMA.
Now, can you actually just elaborate the MGMA? There may be some people, they may not know what MGMA is.
Sure. MGMA stands for Medical Group Management Association. They are one of the key players in healthcare management, healthcare industry. They do bring together a platform for providers and healthcare executives from across the nation, and from advocating for providers to providing resources in various fields of healthcare management. They are a great resource. They also sponsor the ACMPE board certification. And that is basically a program where healthcare executives work towards through body of knowledge, varying from, finance to IT to practice management, basically every business-related aspect of a successful medical practice management. And once individual pass the board exams, they are board certified.
All right, and then we have several different teams now. They are going through this process, and you were one of the first group that was certified, right?
Correct. Mm-hmm.
All right. So, and what else do we have?
So on the team side, I do want to also emphasize the diversity and inclusivity we have in our workforce. And I'm, again, really proud to be one of the women who make up the majority of our leadership and managers at United Medical, starting with our director, Richa Shah, from credentialing to payment posting to collections and AR, RCM management. We have women leaders at United Medical. We also have a dynamic and efficient approach to work, Kamal. I think especially with the pandemic and fast pace of the pandemic-related changes, environment, we proved that we are highly adaptable and flexible. And I want to say we thrive in face of change and challenges, actually. So with your leadership, of course. And lastly, our leadership team has over 50 years of cumulative experience in the healthcare industry. On the next slide, Kamal, are you able to switch?
When I do these drawing stuff, I have to go back to the lead all and.
Okay, great, thank you. So from revenue cycle management perspective, here at United Medical, we service over 100 clients, close to 400 providers across the nation, basically. We have right now, I believe, from 27 different states and including 23 specialties. We have different providers across the nation that we service. Here, I wanted to use this image because this shows the full cycle of revenue cycle management, which starts with patient registration, the steps that are followed in the practice towards AR, denial management, payment posting, billing, collections, and revenue and realized revenues. And actually, more can be reached at your article on LinkedIn. It was a good article. But I want to say what differentiates United Medical is not just routine denial management, because that would be too easy, right? Here we do really have a holistic approach to revenue cycle management. So we try to fine tune our processes. We audit our work. We ensure quality and accuracy of our team's work. But we also look at the metrics always, and we try to realize increased revenues, ensuring like the KPIs basically improve over time. Kamal, it's, I think, very important to also mention how much effort we put into provider advocacy rights, especially with the payer relationship management we have. It's not only the denials we work on, but we are here to advocate the rights of the providers to make sure that they are getting reimbursed at the rate that they are promised, or they must be reimbursed for the services that they already rendered. For their patients. And while doing that, we try to ensure always patient centricity.
So, I always say that this is our core business, revenue cycle management. We used to call it medical billing only, but it got more complicated in time. So when I started, I was an intern in Delaware Cardiovascular, May 2000, year 2000, and that's about 21 years almost.
Almost your age, right?
It's my age, right? So, that time versus now, what needs to be done in the medical billing world, actually it changed. It's day and night. So the complications, requirements, that's why we have to pay a lot of attention to the education of our resources. Mm-hmm. And something that I started initially, it wasn't enough with one person, and it needed a lot of other people who have similar education background and experience from in the field. So now we have an extremely strong team helping our clients nationwide. So that's extremely important. So also understanding our clients. So that's one of the things that I always say. Autonomy for our physicians is extremely important. So that's why they want to be in private practices. What we were able to actually recognize early on is what the client wanted to do, where they were happy, and then if we can actually complement them rather than competing with the client or trying to take their autonomy away. Like the hospital systems, all they do is as soon as they buy the practice over, it becomes this employment issue, and physicians are not happy in the employment, that type of employment setup. So that's what United Medical is able to provide for our practices, and I'm actually extremely happy that we are able to keep that up. And I always say I'm not going to be too humble about, if it wasn't for me, there wouldn't be this many private practices in Delaware, and that is actually very true. Because we know, and in the last 5-6 years you've been here, you have seen hospitals taking over private practices.
Right.
4 of our surgical practice were taken over by the hospital, and the surgeons became employee of the hospital. But we were able to keep the biggest bariatric group, CRIAS, Christiana Institute of Advanced Surgery, as they're our partner in the American Surgery Center. But just, how it becomes more complex, right? So it wasn't about just the billing part of it, but it was also about...
it is never just the billing part, right?
So, although what we have to always remember is the billing is the core
It is.
business, core service that we have, but sometimes it's easy to get sidetracked with all the others. But luckily, we have a great team, and the team actually have not only in the revenue cycle management, but from the operational side, from the business development, we have right people in place, and with the accountable care organizations. One thing that I wanted to actually share while we are talking about the revenue cycle management is this piece here. Right now, we are actually sending our application for the Medicaid ACO, although we are the first ACO who work with the Medicaid MCOs in the state of Delaware. We have to still get certification for Medicaid for the central office. So this is the program that we have to put together. Although again, we are a billing office, right? So we are a revenue cycle management service as our core business, but all these stuff are happening at the same time, because if we haven't done those, then we wouldn't be able to keep those clients independent. It's extremely pleasing that we are able to.
Kamal, I'm actually really happy that we are doing always our best for, improving the health of our patients, and also ensuring, everything is smooth for our providers. Correct me if I'm wrong, only in Delaware, we manage over 250,000 patients, right? Through the United Medical ACO, we manage.
So total number of patients we serve, it's probably even maybe more than 250, but just from the primary care level, pediatric and primary care level, that number is about 115,000, which at that level, it's extremely strong. And but sometimes we don't get the right recognition or fair recognition. Just like Tom Carper going to Christiana Hospital while President Biden goes to Christiana Hospital logo, we could have vaccinated him in our offices, and trust me, I would probably not put the logo behind them because I would try to protect them. But there's a different understanding. It's fine, but there are politicians and they need to get their own satisfactions. But from our side, we are serving our society. That's all I care. We are serving. We are providing service for our residents in Delaware from the clinical side, and our clients around the United States from 27 different states, and that is extremely pleasing from our side. Now, one other thing that I want to share from United Medical side. Right now, we have the new blog that our marketing team actually put together. This is available through our website, and then they have already started posting. These are on top of the articles that I used to write, and I still write some. But this is very nice, actually, the way that they put it. And I want to make sure that our audience is able to see them. Now, from the digital health record side, we have all these events through our channels available, our media channels available. And I'm hoping that our patients and people in the United States or around the world, they find this helpful. Now, this event is going to be, as it's been happening, it's going to be at 12 noon. And one other thing I want to share with you guys is we kind of forgot that for today, but we have this Friends of Tigray, Delaware is one of our nonprofit organizations that we set it up to voice out the issues related to Ethiopian conflict with Tigray. And what's amazing with social media, and I know you actually, interesting enough, although you are in the RCM side, you do help the marketing people a lot, and including myself. So I get a lot of good feedback from you. Well, not good feedback, but useful feedback sometimes.
Okay, great to hear.
It may not be good, but the power of social media is extremely important, and we want our people to understand this. This is one month reach from Friends of Tigray, Delaware. This is about 387,000 people we were able to reach. And actually, if I can make this 7 days, that's 314,000 is since the last video we have done for Tigray. And the only unfortunate part is that Tigray is still suffering. I know that you guys are following that as you are supporting some of my events. So we are hoping that we can see some resolution in the next couple of days. But just from the way that we are communicating with our patients, I find this extremely helpful for us to be able to reach out to others and also see what can be done at different levels. And thank you guys for being part of this and making this available, because if not everyone is supporting, then we won't have time to do all of these. And it is extremely important for us to be able to do them, because we just want to make sure that we have a more meaningful impact in the society that we live in. That's one of the reasons that I accepted the board seat at Brandywine SPCA. I will share more updates in the future, but there are some projects in Delaware, and we want to actually support them as much as possible. But one of the first things I told them that we can always do live sessions, and Tanner, you don't know yet, but I already volunteer you for that. So we'll be able to do events, because now we know how to do it and we have our audience, and it's more about outreach to people who may have these issues, and we'll be doing these more frequently, hopefully.
Yeah, and Kamal, same for your live sessions with Dr. Irga on Tigray especially. I have been following them, and it's really helpful in voicing the issues of Tigray. Thanks for doing that.
Yeah, I mean, the last video right now, actually today I didn't check. It is already almost at 15,000. It's sometimes it takes time to really get to the right audience, and we have we did 4 videos. The first 3 didn't have this much reaction, but I think as more people are aware of what's happening, they are following. And then this video is already in 1 week, and we are almost at 15,000. And I'm hoping that we are not looking for any return for ourselves. We are all we are expecting is the meaningful impact that we can have, and we can also expedite the resolution for any of the issues that we have. So I'm hoping this would be possible, and we can see them all together. Well, Beste, Tanner, thank you for joining me today. And
thank you.
Have our bariatric event starting at 1, which is in 8 minutes. Dr. Irga will be with me. We are going to talk about the cost of bariatric surgery. We'll be a little bit more specific with some, and we'll be back in 8 minutes. All right. Well, thank you so much. Have a nice weekend. Bye-bye.
Thanks, Kamal.